The first tip is facial cleansing. It should be done twice daily, preferably with warm water and a mild facial cleanser. After cleansing, the face should be gently dabbed dry to retain moisture. Pricking and squeezing acne is discouraged. It's also important to note that acne is not a condition of poor hygiene, and aggressive skin cleansing and scrubbing is not helpful and may be damaging to the skin. Tip number 2 is always moisturize your skin. It is important to use an oil-free, non-comedogenic moisturizer. There are so many moisturizers in the market, and you can choose one that is suitable for your skin type. Tip number 3, sunscreen. Always wear sunscreen. It should be used in order to minimize the risk of exposure of the skin to the sun, which may lead to sunburns or skin cancer from the ultraviolet rays. Tip number 4 is the kind of cosmetics you use. Stop using cosmetics that may be causing acne or acne-like eruptions, which may be due to clogging pores, or you may be allergic to one of the products used in making that cosmetic product. Tip number 5 is medication. Some of the medication you are using may be the one that is precipitating your acne. However, withdrawal or substitution of acne-inducing drugs should only be done under the supervision of a licensed medical practitioner. With the above tips, it may help in improving your acne symptoms or protecting your skin from acne. That's all for today.